It's a delight and privilege to catch up with Yeshwant Saoji. Yeshwant, who's a practitioner, educator, he's the owner of Saoji Vision Care, but overall a well-recognized optometrist in India, who also won the 2011 Optometrist of the Year award from Shankar Netralaya. So it's a delight that you can join us in this conversation, Yeshwant.
Thank you, Vinod. Thank you very much. Likewise, I'm also very happy to be here.
So Yeshwant, there is this word digital eye strain. We hear this term quite often. I mean, what is it?
See, because of the corona pandemic and because of the lockdown effects, more often people are inside their houses and the work is going on screens, whether it is your mobile screen or your laptop or whatever. So because of which the eyes are kind of put to extra strain. Now, our eyes are primarily built for outdoors. They are built for seeing distance. Whereas right now we are all sitting indoors and concentrating on our near and maybe screens. So that puts extra strain on your eye muscles, which is also known as digital eye strain. And parents these days are worried a lot about the excessive use of technology, which can cause this digital eye strain.
And I guess, what does digital eye strain lead to? I mean, say if somebody over abuses their eye, using these this medium, what would that lead to for them?
All this is actually also known as computer vision syndrome, which an optometrist studies in optometry school as well. But I feel it's a very big term that we are giving to a set of complaints or set of symptoms which can very easily be managed. So personally, I'm of this opinion that we should really not scare the patients by calling it a computer vision syndrome, or, because all these things can be very, very easily managed. What happens is when you're working too much for near, it causes some accommodation issues, some convergence issues, which need to be diagnosed and managed properly by seeking professional help. What the parents and what the people who are working on screens, they need to understand is just listen to your eyes. Your eyes will complain to you, and that complaints you should be able to recognize and then convey it to your professional who can take care of it. There is no irreversible damage as of now. That is what I personally believe. So I don't think we should worry about it too much, but definitely it needs professional help, and the patients can carry on very well with their laptop and phone related activities without causing too much of permanent damage.
But in terms of standard practice, people who are right now, going to university or even working, who have to use computers and gadgets quite a lot, what would your advice be? What are things they should be doing to make sure, they keep their eyes as safe as possible?
See, generally, Vinod, what I have seen is, I've got a couple of patients in the last week who walked inside for my consultation, and they were told that you already have a -8 and -10 prescription. So you should not take up professions like chartered accountancy or, architecture, which involves too much of minute drawings and too much of working with numbers. Now, I am of this school of thought, I don't want to restrict their work period or work times on computers, but I would like to develop their eyes to actually withstand the onslaught which the online work is causing on their eyes. I mean, if you talk about a person like me, I am more of a sedentary person. If you want me to run a marathon, can I run it? I don't think I can. But if I train myself to run a marathon, maybe after a month or after 2 months, I can, right? So we need to, if the online work is involving maybe 5-6 hours today, which earlier was like 1 hour or 2 hours max, I can train the eyes to make them suitable for absorbing this onslaught. So they just need to, as I said earlier, seek professional help and develop your eye muscle strength to such an extent that it will not affect you so much.
But maybe, see, 20, 30 years back, when computers were not that big, every home might not have had a computer or a smartphone, people would still read a lot in very low light. And there were a lot of warnings saying, look, your light's not enough, it's going to damage your eyes, etc., etc. So how different is this compared to, people who read in very low light, which they would have been done, traditionally?
In fact, very good question. There is so much of confusion regarding this. Why blame the devices when myopia is increasing even before the devices came into picture? So we really don't know what is causing this increase in the eye strain and increasing myopia-related incidents. But I think it's more related to both. I mean, working too much on laptops and not going outside. In the earlier periods, if you remember, we used to venture out a lot. I mean, almost all evenings, I remember as a child, I used to play outside. So these days, people don't get outside exposure. And there is something magical about the daylight which gives you a lot of relief from eye strain and which helps you to prevent myopia related issues. So this kind of exposure coupled with near vision activities, and in earlier times, if you remember, our houses were very big. These days the houses are becoming smaller and smaller. The bedroom size or the room size where you're working is becoming smaller and smaller. So your eyes are constantly in that accommodated state. They never relax. So maybe that is one of the issues which is troubling today's generation.
And my final question is, so Yeshwant, if you have to give, three bits of advice, just three short things that people need to take away, what would they be, especially for people who are using technology quite a lot in their homes, their offices, and they're just listening to you? What would you tell them?
Okay, it's very difficult to summarize everything in 3 points, but if I have to compulsorily summarize in 3 points, one, I would say don't be scared. Don't restrict your screen time. Everything is manageable. You just need to listen to your eyes and seek professional help. And the second part, which most often is being ignored by people, is take adequate rest. Because you're exposing yourself to so much of screen time, you also need to get quality sleep. So make sure you aim to sleep at least for 6 to 8 hours, and it has to be quality sleep, which will prepare you for the next day's onslaught. And the third and possibly a very important aspect which is often neglected is selecting your eyewear properly. Now, whether you should have XYZ coating on it or ABC coating on it, whether your spectacle should be aspheric, it should be non-aspheric, whether you need to wear anti-fatigue lenses or not. So all this can be concluded properly if you seek professional help and if comprehensive eye examination, which includes your eye muscle strength evaluation. If that is done, then the optometrist can suggest to you what is the most ideal glass. So selecting the right ideal glass and seeking professional help will definitely prepare you to face this onslaught in a very, very comfortable way.
Yeah. And before we close, just one clarification on what you said, Yeshwant. So you said listen to your eyes. So when you say listen to your eyes, what would your eyes, how would they tell you that they are tired? Would it be where they're irritated, whether they are red? What are common symptoms that tell them, look, you're over?
Redness may not come about in the initial stages. Redness will come only if you face problems related to dryness in the eyes. Okay, but basically, you might want to just close your laptop. You might want to go off to sleep, or you might just want to shut off few lights. Even the extra light will irritate your eyes, or you'll find yourself reducing the brightness of the screen because you're not able to tolerate that brightness. So any feeling which is different from the normal, that has to be reported to your eye care professionals, because then they can pick up what is wrong. Now let's say if I'm not able to tolerate the brightness of the screen, I'm not able to tolerate the tube light in my room, I can tell you for sure accommodation and conversions would be affected.
Right.
So these are hints which your eyes are giving you. You don't feel like working on the laptop at the end of the day, but you're okay in the morning. Right. Then you know your reserves are depleting, or you're not getting adequate sleep. So the professional can actually recognize these symptoms and reach to a proper conclusion.
Thank you so much. Very useful tips. Thank you so much for your time, Yeshwant. Best wishes in everything you're doing.
Thank you, Vinod. And I hope that people have something to take away from this. And I don't want people to be unnecessarily scared about it. It is something to worry about, but we all know that there are solutions available. So don't fret too much about it.
Thank you.
Thank you, Vinod.